And I'd like to thank our witnesses for being here today to talk about a subject that's bothering so many of us. We're so concerned about our communities and the hesitancy that is displayed daily. We know all the stories about why people are hesitant, why they're suspicious. We know the distrust because of the way we've been treated in the medical community with experiments, et cetera. We know all of that. And we're talking to people and warning them ad nauseum. We're saying you may die if you're infected and you have not been vaccinated. So we've done all of that. So now I'm really looking at incentives. I'm looking at what incentives work and how we can involve maybe the private sector in supporting us with incentives to get particularly young people out. Now, either of you have any knowledge or experience that you can share with us about whether or not incentives work and whether or not it is ethical to do incentives. First, Dr. Adams, what do you think?
Well, thank you so much. And actually, I would direct the question to Dr. Milkman because she wrote the book on this. She is the expert on this.
Oh, she did?
But yes, she is, and she's on, and she is the expert on the panel on incentives. But what I would say to you very quickly is you need to have the right incentive for the right audience. And a blanket incentive isn't going to work for every population because it's not going to address the concerns that particular populations have. So African Americans may respond to different incentives than Hispanics and Latinos, than rural communities. But again, I'll throw it to the expert who is here, Dr. Milkman.
Sure. No, the evidence that incentives work is building. We have decades of evidence that they work for changing health behaviors. In other contexts, of course, we only have a little bit of evidence to date on how well they're working for COVID-19 vaccinations. But as I mentioned earlier, the Ohio Vaccimillion data is already looking very promising. There was a 28% increase in vaccinations in the week following the announcement of that, and we believe that in the 2 weeks following, there were an extra 50 to 80,000 vaccinations given. Now, you asked a question about particular communities and do they work differently in different communities, and I wish we knew more about that. One thing that we're pioneering in Philadelphia, where I co-designed the Philadelphia Vax Sweepstakes, is a kind of lottery incentive that's actually focused on communities where there are low vaccination rates. So we are running a citywide sweepstakes, but we are giving half of the prizes in each round, in each drawing, to a particular zip code that's under-vaccinated, and I think we should be doing more to target those under-vaccinated communities. A nice thing about lottery incentives is that they draw tremendous media attention. We think that's part of why they're so effective. People get very excited. There's vivid stories, which is important. We just talked about the importance of stories. You have vivid stories now of winners, happy stories, which people like to hear about. And so I strongly encourage more communities to think about doing localized incentive programs.
Well, thank you.
And ma'am, work sites, incentives at work sites are key. Working with businesses, people spend more of their waking hours at work than what they do at home. And the people are going back to work. Aptiv is a company, an electronics manufacturer that's working with Texas on the border to vaccinate people on both sides. Again, important that and I encourage the committee, and I put in my written testimony that you all should work with businesses, Department of Labor and SBA to encourage and empower work sites to offer incentives and on-site vaccinations.
Now, you may be the wrong experts to ask about this, but of course I was at the BET Awards this past weekend, and I was looking at Lil Baby and Rhapsody and these rappers and how thrilled young people were with them, young people that they have around the stages screaming. What about that? Entertainment, athletes, rappers, you think they could be helpful in, helping us to get certain groups of people out? What do you think, Dr. Benjamin?
Absolutely. The right messengers are important. And I can tell you what we've learned from, our tobacco work, our anti-tobacco work, is that peer-to-peer education is very important. So getting young people to talk to other young people and getting them well educated. Just up the road here in Maryland, my colleagues at the University of Maryland have barbers that are talking to folks in the community. You know, lots of stuff gets talked about in the barbershop and while you got in that chair. And we did it through it, you know, when I was here in D.C. as a health officer, we used lay barbers and others to educate the community about a range of health threats, and we believe this will be effective. The dean at the University of in New Orleans at Tulane also has a barber program, a community program. It turns out it works.
Well, thank you so very much. Like I said, I know we've all been preaching and talking, so we got to be creative. We got to come up with some new ways by which to do it. Thank you very much for being here today. Thank you all.